Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that make it hard to breathe. The most common of these diseases are emphysema and chronic bronchitis. Millions of people around the world live with COPD, many without even knowing it. The primary cause of COPD is smoking, but other factors like air pollution and genetics also play a role. In COPD, airways become inflamed, narrowed, and lose their elasticity. This makes it difficult for air to flow freely, especially when you exhale. COPD is a progressive disease, meaning it gets worse over time. Early diagnosis and treatment can slow down its progression and improve quality of life. COPD often sneaks up on you. The early symptoms can be subtle and easily dismissed as just getting older or being out of shape. However, paying attention to your body and noticing any changes in your breathing is crucial. One of the earliest and most common symptoms of COPD is shortness of breath, especially during physical activity. You might find yourself getting winded easily while climbing stairs, walking briskly, or doing everyday chores. This shortness of breath tends to worsen over time. Another telltale sign is a persistent cough, often referred to as smoker's cough, even if you've never smoked. This cough may produce clear, white, yellow, or even greenish mucus. Wheezing, a high-pitched whistling sound when you breathe, is another symptom that shouldn't be ignored. It's important to remember that these symptoms can also indicate other respiratory conditions. If you experience any of these signs, particularly if they last for more than a few weeks or worsen progressively, it's essential to consult a healthcare professional for a proper diagnosis. Living with COPD can feel like a roller coaster ride. You might have periods where you feel relatively well, followed by periods when your symptoms suddenly worsen. These episodes are called COPD exacerbations or flare-ups. Exacerbations are like attacks on your already compromised respiratory system. They are characterized by a sudden increase in shortness of breath, coughing, wheezing, and mucus production. The mucus may also change color, becoming yellow or green, indicating an infection. Several factors can trigger these flare-ups, including respiratory infections like colds and the flu, exposure to air pollutants like smoke and fumes, and even extreme weather conditions. Managing exacerbations is crucial because they can lead to complications, hospitalization, and even worsen the overall progression of the disease. Early diagnosis of COPD is paramount to receiving timely treatment and slowing down the disease's progression. If you experience any symptoms suggestive of COPD, your doctor will likely perform a physical exam and ask about your medical history, including smoking history and exposure to environmental irritants. The gold standard for diagnosing COPD is a spirometry test. This simple, painless breathing test measures how much air you can inhale and exhale and how quickly you can do it. Spirometry helps determine the severity of airflow obstruction and track lung function over time. Your doctor may also recommend other tests, such as a chest X-ray or CT scan, to rule out other respiratory conditions and get a clearer picture of your lungs. These imaging tests can help identify emphysema, which is characterized by damage to the air sacs in the lungs. Section 5. Breathing easier. Treatment options for COPD. While there's no cure for COPD, treatments can help manage symptoms and improve quality of life. The cornerstone of COPD treatment is quitting smoking. Medications play a crucial role in controlling symptoms. Bronchodilators relax airway muscles, making it easier to breathe. Inhaled corticosteroids reduce airway inflammation. Pulmonary rehabilitation combines exercise, education, and support. Oxygen therapy may be necessary for severe COPD. In some cases, surgical interventions may be considered. Section 6. Navigating a flare-up. COPD exacerbations are a serious matter and require prompt action to prevent complications. If you experience a sudden worsening of your symptoms, it's essential to contact your doctor or seek immediate medical attention, especially if you have difficulty breathing, your lips or fingernails turn blue, or you experience confusion. Your doctor may prescribe additional medications, such as antibiotics, if the exacerbation is caused by a bacterial infection, or oral corticosteroids to reduce airway inflammation. You may also require supplemental oxygen therapy to maintain adequate blood oxygen levels. During an exacerbation, it's crucial to rest as much as possible and stay hydrated by drinking plenty of fluids. Avoid exposure to irritants like smoke, dust, and fumes, as these can worsen your symptoms. Follow your doctor's instructions carefully and keep them informed of any changes in your condition. Section 7. Preventing COPD flare-ups. While it's impossible to prevent all COPD exacerbations, you can take proactive steps to reduce their frequency and severity. Vaccination is crucial, so make sure you're up to date on your annual flu shot and pneumonia vaccine. Practice good hygiene, especially during cold and flu season, to reduce your risk of infection. Wash your hands frequently, avoid close contact with sick individuals, and disinfect surfaces regularly. If you do get sick, stay home to prevent spreading germs to others. Manage your COPD effectively by taking your medications as prescribed, attending pulmonary rehabilitation sessions, and avoiding triggers like smoke, dust, and fumes. Stay active, eat a healthy diet, and maintain a healthy weight to support your overall health and immune system. Section 8. The importance of early action. COPD is a serious lung disease, but with early diagnosis, proper management, and lifestyle modifications, you can live a full and active life. Don't ignore the warning signs. If you experience persistent coughing, shortness of breath, wheezing, or excessive mucus production, consult a healthcare professional promptly. Early diagnosis allows you to start treatment sooner, which can slow down the progression of the disease and preserve your lung function. It also gives you time to make lifestyle changes, such as quitting smoking and avoiding triggers that can significantly impact your quality of life. Remember, COPD affects not only your physical health, but also your emotional and social well-being. Seeking support from loved ones, joining support groups, and talking to a therapist can provide emotional support and help you cope with the challenges of living with this chronic condition. Section 9. Living well with COPD, a story of hope. Meet Sarah, a vibrant 65-year-old woman who was diagnosed with COPD 5 years ago. Initially, Sarah felt overwhelmed and discouraged by her diagnosis. She worried about her future and how the disease would limit her life. However, Sarah was determined to live her life to the fullest. She quit smoking, started pulmonary rehabilitation, and became diligent about taking her medications as prescribed. She also made changes to her home environment to reduce triggers and joined a COPD support group. Today, Sarah enjoys an active lifestyle. She walks regularly, participates in water aerobics, and even volunteers at a local community garden. Sarah's story is a testament to the fact that while COPD presents challenges, it doesn't have to control your life. Section 10. Your lungs, your life. Take charge today. Your lungs are essential for life. They work tirelessly every second of every day to provide your body with the oxygen it needs to function. COPD can significantly impact your lung health and overall well-being, but it's not a lost cause. By understanding the symptoms, causes, and treatment options for COPD, you can take charge of your lung health. If you're at risk due to smoking or exposure to environmental irritants, consider talking to your doctor about getting screened. Early detection is key to slowing down the progression of the disease. Remember, you are not alone in this journey. Millions of people around the world are living with COPD, and countless resources are available to support you. By taking proactive steps